Welcome to Psychology Insights Explained, or PIE. Here's a slice of pie. Today's slice will explore a mental health treatment that is often misunderstood, electroconvulsive therapy, or ECT. You might know it by its more common name, shock therapy. It's a term that often evokes fear and misunderstanding. The truth is, ECT has been a safe and effective treatment for severe mental illnesses for decades. In this video, we're going to unlock the mystery surrounding ECT, exploring its history, its science, and its potential to provide relief for those who need it most. We'll separate fact from fiction and provide you with a clear and compassionate understanding of this often misunderstood treatment. Whether you're someone who is struggling with a mental health condition, a family member seeking information, or simply curious about ECT, this video is for you. Throughout history, mental illness has carried a heavy stigma. Fortunately, we live in a time where conversations about mental health are becoming more open, and treatments like ECT are stepping out of the shadows. One of the biggest hurdles ECT faces is its negative portrayal in popular culture. Movies and TV shows often depict ECT as a barbaric and inhumane treatment, used as a form of punishment or control. But this couldn't be further from the truth. Modern ECT is a far cry from the sensationalized images we see in media. It's a carefully controlled medical procedure administered under general anesthesia by a team of trained medical professionals. Patient safety and well-being are paramount throughout the entire process. In reality, ECT is often a last resort for individuals with severe and treatment-resistant mental illnesses. These individuals have often tried numerous medications and therapies without success, and ECT offers a beacon of hope when all other options have been exhausted. The story of ECT begins in the 1930s, a time when treatment options for severe mental illnesses were extremely limited. Dr. Ladislas Meduna, a Hungarian neurologist, observed that some patients with epilepsy experienced a reduction in their psychotic symptoms after having seizures. This observation sparked an idea. Could inducing seizures in patients with severe mental illness offer a potential avenue for treatment? This marked the genesis of ECT. The first ECT procedure was performed in 1938 by two Italian physicians, Ugo Cerletti and Lucio Bini. These early treatments were crude compared to the controlled procedures we have today. Patients received significantly higher doses of electrical current without the benefit of anesthesia or muscle relaxants, leading to a higher risk of side effects, including memory loss and fractures. Imagine the fear and discomfort those early patients must have endured. Thankfully, ECT has undergone significant advancements since its inception. Over the decades, researchers and clinicians have worked tirelessly to refine the procedure, making it safer and more effective. One of the most significant milestones was the introduction of anesthesia and muscle relaxants in the 1950s. This dramatically improved patient safety and comfort by eliminating seizures and reducing the risk of physical injuries. With these advancements, the perception of ECT began to shift, paving the way for its wider acceptance as a viable treatment option. Further refinements included the use of briefer electrical pulses, modified electrode placement, and personalized treatment plans tailored to each patient's needs. These advancements led to a significant reduction in side effects, particularly memory loss, which was a major concern in the past. The evolution of ECT mirrors the broader advancements in medicine, where continuous research and innovation drive progress and improve patient outcomes. Despite its progress, the history of ECT is not without its shadows. The early years, marked by rudimentary techniques and a lack of understanding of its long-term effects, led to misuse and ethical concerns that still linger today. It is crucial to acknowledge this past and learn from it to ensure that ECT is always used responsibly and ethically. The horrors depicted in movies, though exaggerated, hold a grain of truth from a bygone era. Today, strict ethical guidelines and regulations govern the use of ECT, and informed consent is paramount to ensure that patients fully understand the procedure, its potential benefits, and risks before consenting to treatment. The use of ECT is carefully considered, and typically reserved for only the most severe cases of mental illness, where other treatments have proven ineffective. By acknowledging the ethical considerations and implementing modern safeguards, we can ensure that ECT is used responsibly and compassionately, providing much-needed relief to those who benefit from its therapeutic effects. Now let's look at the science behind ECT. How does a brief electrical current applied to the scalp impact something as complex as the human brain and alleviate symptoms of severe mental illness? While the exact mechanisms are still being researched, we know that ECT influences brain activity in several key ways. The electrical current induces a brief, controlled seizure in the brain. This seizure, unlike those experienced in epilepsy, is not harmful and is carefully monitored by medical professionals. Think of it like a reboot for the brain, resetting its electrical activity and promoting communication between different brain regions. This reset is believed to help restore chemical imbalances in the brain, which are thought to contribute to mental illness. To understand how ECT impacts mental health, we need to talk about neurotransmitters. These chemical messengers play a crucial role in regulating mood, sleep, appetite, and other essential functions. Imbalances in these neurotransmitters are implicated in various mental illnesses, including depression. For example, low levels of serotonin, often called the feel-good hormone, are linked to feelings of sadness and despair. ECT is believed to impact the production, release, and uptake of these crucial neurotransmitters. Research suggests that ECT can increase levels of serotonin, dopamine, and norepinephrine, all of which play a role in mood regulation and motivation. By restoring a healthy balance of these neurotransmitters, ECT can help alleviate symptoms of depression and other mental illnesses. While ECT is most commonly associated with treating severe depression, its therapeutic reach extends beyond this single condition. ECT can also be an effective treatment for other severe mental illnesses, including bipolar disorder, schizophrenia, and catatonia. In individuals with bipolar disorder, ECT can help manage both manic and depressive episodes, offering stabilization and relief. For those with schizophrenia who haven't responded to medication, ECT can alleviate symptoms like hallucinations and delusions. And in cases of catatonia, where individuals experience severe immobility or unresponsiveness, ECT can be a life-saving intervention, helping individuals regain some level of function and interaction with the world around them. This versatility makes ECT a valuable tool in the psychiatrist's arsenal for treating a range of complex mental health challenges. Depression, often called the common cold of mental illnesses, affects millions worldwide. While many find relief through therapy and medication, a subset of individuals experience depression so severe that it becomes life-altering. This is where ECT steps in as a beacon of hope. Imagine, if you will, a darkness so profound that it permeates every aspect of your being, stealing your joy, motivation, and even the will to live. This is the reality for many individuals battling severe depression. For these individuals, ECT can be a lifeline that finally offers them a path out of the darkness. Once again, ECT is not a first-line treatment for depression. It's only for those individuals who have been unsuccessful with traditional approaches and for whom all other options have been exhausted. Antidepressant medications, while effective for many, don't work for everyone. Some individuals may experience little to no relief from medication, while others may encounter intolerable side effects. This is known as treatment-resistant depression, a frustrating and often debilitating condition. For these individuals, the search for effective treatment can feel like an uphill battle, leading to feelings of hopelessness and despair. This is where ECT offers a glimmer of hope, a potential solution when all other avenues have been exhausted. ECT is not a magic bullet, and it's important to have realistic expectations. However, for individuals who have found no solace in traditional treatments, ECT can provide a much-needed ray of light, offering a chance to reclaim their lives from the grips of severe depression. Just as every individual's experience with depression is unique, so too is their response to ECT. Treatment is not one size fits all, it's carefully tailored to each patient's needs. Factors such as age, overall health, the severity of symptoms, and previous treatment history all play a role in determining the optimal treatment plan. This personalized approach ensures that patients receive the most effective and safest care possible. ECT is typically administered in a series of sessions, usually 2 to 3 times a week, over several weeks. The number of treatments required varies depending on individual response and the severity of symptoms. Throughout the treatment course, patients are closely monitored for any side effects and their progress is carefully assessed. This iterative approach allows for adjustments to be made along the way, ensuring the best possible outcome. Undergoing ECT is a big decision, and it's natural to have questions and perhaps some anxiety. Your medical team will guide you every step of the way, providing clear explanations and addressing any concerns. Before your first ECT treatment, you'll undergo a thorough medical evaluation. This includes a review of your medical history, a physical examination, and possibly some tests. Your doctor will discuss any medications you're taking, as some may need adjustment. Remember, your medical team is your ally, dedicated to providing you with the best possible care. On the day of your ECT treatment, you'll arrive at the hospital or treatment center and be greeted by a team of compassionate and experienced medical professionals. You'll be taken to a specially designed ECT suite, a calm and reassuring environment where the procedure will take place. An intravenous line or an IV will be inserted into your arm to administer medications, and you'll be connected to monitors that track your heart rate, blood pressure, and brain activity throughout the procedure. Don't worry, you won't feel anything during the procedure. You'll be given general anesthesia, which means you'll be asleep throughout the treatment, and a muscle relaxant will also be administered to prevent any muscle contractions during the induced seizure. The electrical current is delivered through electrodes placed on your scalp, and the entire procedure typically lasts just a few minutes. Throughout the treatment, your medical team will be closely monitoring your vital signs to ensure your safety and well-being. After the procedure, you'll be taken to a recovery area where you'll gradually wake up under the watchful eye of medical staff. You might feel a bit disoriented or groggy initially as the anesthesia wears off, but this is completely normal and temporary. Most people recover from ECT quickly and are able to go home the same day. You'll need someone to drive you home as you won't be able to drive for the rest of the day. In the days and weeks following your ECT treatments, you'll likely notice gradual improvements in your mood and overall well-being. The darkness that once seemed all-encompassing may begin to lift, replaced by a renewed sense of hope and vitality, and you'll start to experience the world with more vibrancy, rediscovering joy in the simple pleasures of life. It's important to remember that recovery is a journey, not a destination. As we've explored in this video, electroconvulsive therapy, or ECT, stands as a powerful tool in the treatment of severe and treatment-resistant mental illnesses. Its ability to provide relief and restore hope to individuals facing the darkest depths of debilitating mental health conditions is undeniable. The advancements in ECT over the decades, from its rudimentary beginnings to the safe and controlled procedure it is today, highlight its evolution as a vital component of mental health care. However, like any medical procedure, ECT is not without its considerations. While the side effects are generally mild and transient, the potential for memory loss, albeit usually temporary, must be acknowledged and carefully managed. Open communication between patients, their families, and their medical team is crucial throughout the entire process, to ensure informed consent and to address any concerns that may arise. Ultimately, the decision to pursue ECT is a deeply personal one, made in consultation with medical professionals and guided by individual needs and circumstances. Despite its proven efficacy, ECT continues to carry a stigma, often fueled by misrepresentations in popular culture. At every opportunity, we should challenge these misconceptions and foster informed conversations. By dispelling myths and sharing accurate information, we can create a more supportive environment for those considering ECT. Mental illness is not a sign of weakness. Seeking help is a sign of strength. Knowledge is empowering. If you or someone you love is struggling with a severe mental illness, I encourage you to seek professional help. There are resources available and you don't have to navigate this journey alone. If you're interested in learning more about ECT, reputable organizations like the American Psychiatric Association and the National Alliance on Mental Illness offer valuable information and support. Don't hesitate to reach out to your doctor or mental health professional to discuss whether ECT might be an appropriate treatment option. Your voice matters. And by sharing your experiences and advocating for greater understanding, you contribute to a more informed society. Let's continue to shed light on ECT and other mental health treatments, ensuring that everyone has access to the care they need to live full and meaningful lives. Thank you for joining me on this journey of unlocking the mind and exploring the science of electroconvulsive therapy. Don't forget to like and subscribe to this channel, and be sure to share this video with anyone seeking more information about ECT. Together we can make a difference. Until next time, this is Psychology Insights Explained.